I'd yield back to the let's see to Congressman Brown from Georgia. I think you had the floor for a moment there, and then I'm going to go to Congressman Gingrey, another medical doctor we have joining us. We've got a lot of doctors here tonight, and I'm very thankful for your expertise, my friends.
Well, I thank Mr. Akin for yielding again to me. I wanted to come back to something that my dear friend John Chaddick said, where he's talking about cost. Just wanted to inject here something that happened in my medical practice when I was practicing down in southwest Georgia. And what I'm fixing to say is going to point out that government intrusion in the healthcare system is what's driven up the cost for everybody, whether they're private insurers or public insurers on Medicare, S-CHIP, or Medicaid. Back a number of years ago, I was in private practice, had a one-man office with several employees, and I had a fully automated lab in my office. The patient would come in to see me with a red sore throat, running a fever, aching all over, coughing, runny nose, white patches on their throat. I would, in my fully automated lab, would do a CBC, or complete blood count. I could do that in 5 minutes, charge $12. Well, Congress passed a bill signed into law called the Clinical Laboratory Improvement Act, or CLIA. It shut down my lab, shut down every doctor's lab in this country. All the hospital labs had to get a waiver, and eventually everybody...
Reclaim my time. The laws passed here in Congress shut down a lab that you had to be able to treat people that was an upper respiratory type of infection?
For anything, to do blood sugars, to do blood counts, and this sort of thing.
They shut it down?
They shut it down. CLIA shut every doctor's lab in the country down. But patients would come in with aching all over, red sore throat, and said, I'll do a CBC to see if they had a bacterial infection, thus needed antibiotics. If there's a strep throat, they might need a penicillin shot. Or if they had a viral infection, it could look exactly the same. And a viral infection is not helped by antibiotics. And the teaching that I had in medical school at the Medical College of Georgia and all my training postgraduate has encouraged doctors not to overprescribe medications. It's costly. It increases the cost to everybody. And also, if people have viral infections, they don't need antibiotics. Actually, it's harmful to some patients. So I do a CBC, $12, 5 minutes. CLIA shut my lab down. I have to send patients across the way to the hospital. They got a waiver. Cost $75 and took 2 to 3 hours for one test. Now, you see what that does across the whole healthcare system. It markedly increased the cost. Congress, not just a few years ago, passed HIPAA, the Health Insurance Portability and Privacy Act. That's cost the healthcare industry, thus insurance, and all of us, billions of dollars, and has not paid for the first aspirin to treat the headaches it's created. It was totally unneeded legislation. Totally unneeded. Because we could have done something to make insurance portable without going that route. So government intrusion into the healthcare system and Medicare policy is what's driven up the cost for everybody. And it comes back to what Ms. Chaddick was saying about asking a question. Could any of us answer the question about, has government being involved in any area decreased the costs? And the answer is no. It has increased the cost markedly for the health insurance and everybody else, and it's going to in this too.
Reclaim my time. I think you've really given us several very concrete examples in the healthcare business where the government involvement has basically run the cost of healthcare up. And that's not a big surprise, is it? Because we look at the regular marketplace. I think one of the examples would be the idea of LASIK surgery for eyes. That's one thing the government didn't get its big fingers into meddling, right? And the laser technology has come along, and what used to cost thousands of dollars for a procedure now is done for hundreds of dollars. And so we've seen a dramatic decrease in the cost of good quality care just because the government wasn't tampering in it. And yet every time we see the government get its fingers into things, the costs invariably go up.